This is an audio-visual representation of a study published in the Journal of Bone and Joint Surgery in 2021. Hip dislocation is one of the most common causes for revision of total hip arthroplasty or THA implants, and the number of revisions registered in national arthroplasty registers do not reflect the total burden of this complication. Closed reductions, representing a non-surgical alternative to revisions, are often sufficient to manage hip dislocations, and this maneuver can be performed in the emergency department without hospital admission, or in hospitals different from where the primary surgery was conducted. This procedure is traditionally not captured in arthroplasty registers. A hip revision for instability is usually performed only after recurrent events of dislocation. This makes the exact incidence of dislocation difficult to establish. To assess the true cumulative incidence of hip dislocations within 2 years, including both revisions and closed reductions after THA, researchers investigated 31,105 primary THA cases from the Danish Hip Arthroplasty Register from 2010 to 2014. Hip dislocations were identified in the Danish National Patient Register by extraction of all hospital contacts to the Danish healthcare system within the first 2 post-operative years. The dislocations were verified through a comprehensive and nationwide review of patient files, and risk factors were analyzed. A total of 1,861 dislocations in 1,079 THAs were identified in the patient files, corresponding to an incidence rate of 3.5%. Remarkably, only 2/3 of these cases would have been identified by the correct codes for THA dislocation, while the remaining 30% had been assigned with more or less wrong codes. Patients below 65 years and above 75 years of age were at a lower and higher risk, respectively, for hip dislocation than those in the 65 to 75 years age group. Male sex, cemented fixation, and a lateral surgical approach were associated with a lower risk. Further, a head size of 32 mm was associated with a higher risk compared to a head size of 36 mm, and dual mobility cups were observed to lower the risk of dislocation. The study established the current burden of dislocations in Denmark and revealed that the incidence of dislocations is much higher than the correct registered data would predict. Further, the study emphasizes the need for caution when interpreting results based on registered data alone, and highlights the need for a more comprehensive algorithm that enables a more truthful monitoring of dislocations.